In today's episode, we are in conversation with Dr. Jeff Crippen, who shares his personal journey towards alternative medicine and a holistic approach in managing autoimmune diseases. Dr. Crippen explains general foods that commonly fit within an autoimmune diet and the benefits these foods can have, as well as common foods to reduce, including those that can trigger inflammation. Stay tuned. Dr. Jeff Crippen is a chiropractor, nutritionist, and coach who enjoys helping others unlock their true potential. Dr. Jeff has helped clients both through chiropractic care and nutrition at his wellness clinic in San Joe, Texas, as well as through individualized mindset coaching with Advanced Coaching and Leadership Center. Welcome, Dr. Jeff.
Awesome. Thank you for having me, and I'm happy to be here with you and your audience today, Shireen.
Absolutely. It's such a pleasure having you on. Dr. Jeff, I know you have this amazing story that I actually want to open the episode with, this unique personal journey that really pushed you toward alternative medicine and then ultimately to really taking this holistic approach in your own health. Can you share with us a little bit that story, if you will?
Yeah, absolutely. So my story started when I was about 6 years old, and I started to get headaches, and I did what I knew to do. It really, at that point, what my parents knew to do, which was you go to the pediatrician, and started on some over-the-counter pain relievers, like things like children's aspirin, children's Tylenol, children's Motrin, and then the headaches kept getting worse. They didn't seem to get better. So then I went back to the pediatrician, and eventually you start doing over-the-counter medications that are stronger, and then eventually prescription drugs. And then they continue to progress. And then after a couple years, the headaches were not responding to the medications. And that's, that's what medicine would consider a red flag symptom, which are progressively worsening headaches in a child that don't respond to pain relievers. So I went to a neurosurgeon, did a CT scan of my head, found a mass in my head. They didn't know what it was, then did an MRI, and eventually diagnosed it as a benign tumor. So a benign arachnoid cyst is what it was called, and had a surgical consult about removing it. And ultimately the surgeon, I was about 8 years old, decided not to remove it, and my reaction was disappointed. Right? I was so just kind of in that idea of, I was 8 years old, not really understanding what it really means to go through brain surgery, but just having that idea that the doctor had searched at that point for 2 or 3 years to try to find out what was causing the headache. They found something, and I was very hopeful that, there could be something like a surgery to take it away. That didn't end up being the case, and I'm very thankful that's not the rate I went on. But through that process, over the next 10 years, I probably did another dozen MRIs in my head to make sure that cyst was not growing and not getting worse. Tried another dozen different prescription medications, saw specialists in a variety of different fields, just kind of searching for answers. And a couple things stood out to me as I went through that process. One is, when they were looking for the cyst that caused my head, over those 12 MRIs over 10 years, the cyst never changed. But sometimes the headache was on the left side of my head, and sometimes it was on the right side of my head, and sometimes on the back of the head, and sometimes it pulsed, and sometimes it throbbed, and sometimes it was constant. So I wondered, how could something that never changes, like the cyst, cause symptoms that always change? Right? That was one thing. And the second thing was, often during that time I'd have a visit with doctors and dozens of doctors, but typically I'd spend 5 to 10, maybe 15 minutes with a doctor, which would be a lot outside of the first visit. And I realized none of the doctors ever told me why I was having the headaches. So it always made me curious how they were giving me a solution, which was often the drug to cover up the symptom, without understanding what the problem was. So that was the beginning of my own journey of just kind of looking at the medical system. And I think it's often called a healthcare system, but what I came to realize is that's really a misnomer. It's more of a disease treatment system, right? Because I found there's little health and occasionally bits of care in that system, but far from healthcare systems, more of a disease maintenance or disease treatment system. And that's not to say there's not great people in the system, because there absolutely are. There's incredible doctors and incredible nurses and incredible technology and incredible educational institutions. But because of that, or despite that, we still have a growing epidemic of chronic disease, lifestyle-based diseases in this country, as you've highlighted on the show. So that opened my mind to the idea that, so we have a medical system, but it's not a healthcare system. So how do you actually create health?
And I find this so interesting, and I do want to get into a little bit of that. How just personally, how have you been able to manage your health since then, and how have you carved a path for yourself?
A lot of going down a lot of going down streets and finding dead ends, right? It's kind of where it was. But I mean, I had, at its worst, the headaches were continuing to progress for about the next 10 years. So when I was in high school, that was about when the headaches were at its worst. And at its worst, I had a headache that lasted 2 years. So every moment, every day, nonstop for 2 years. So it really, really impacted my life at that point. And honestly, I kind of hit a breaking point, to the point I made a very clear decision. I'm not going on living like this, in the sense of I'm going to figure out the problem, or I don't even want to think what the other option was. But I 100% got to that point. And so how do you start? Well, I started, I'd read books. And then you'd read a book and it said, like, caffeine can cause headaches. And I was like, well, I'm 12 or 15 and I don't drink coffee, so that's not causing my headaches. Then you read other books that say caffeine is good for headaches. And I was like, still don't drink coffee, right? And then you talk about red wine is benefit for headaches, and I'm 12 at that point, or 18. Like, I'm not drinking red wine. And then other things that tell alcohol or red wine can cause headaches. So you start, as you've covered on the show, like, you start working through some of the confusion and the morass and this idea. And one of the fallacies in medicine is this idea of what I call the Model A principle, or the one-size-fits-all principle. This idea that we're all homogenous, we're all the same, and it's one-size-fits-all medicine, and that is 100% not true, right? Ethnicity matters, gender matters, food choices matter, whether we're pregnant or not matters, whether I'm a weightlifter or not matters, right? Genetically, there's differences between us. So we have this incredible variation, but the only way you can run a medical system seeing patients every 2 to 10 minutes is you have to assume they're all the same. And that was one of the things I learned through that journey. That's just 100% not true. So if we look at a system that's not disease care, but actually is healthcare, what are the principles you have to follow? And one of them is you have to understand the uniqueness, genetically, culturally, metabolically, anatomically, and otherwise, of each patient that walks in your door. And besides that, they all have different goals and different dreams, and there's better ways to communicate with them and talk to them. So those are some of the things that I kind of learned through that experience as a patient and through my last 10, 12 years in practice.
And speaking of which, and speaking of your own practice, in fact, in this episode, we specifically want to talk to you a little bit about autoimmune disease. For our listeners, so let's start out with the basics. For our listeners here who just may not be familiar with autoimmune diseases, could you first explain what they are, and then how they impact the body's immune system?
Sure. Yeah. So auto meaning self, immune disease. So it's a disease. Actually, it's a series of diseases. At last count, there was over 150 known autoimmune diseases, over 159 different autoimmune conditions. So there's an incredible number, everything from Hashimoto's thyroiditis to rheumatoid arthritis to 160 different. They affect about 50 million people in the United States alone. It's over 300, and worldwide it's about 320 million. So it's a very widespread group of diseases. But to your question, what are autoimmune diseases? They're, broadly speaking, a group of diseases where the body's own immune system is attacking its cells. So the immune system is attacking the body. And the question that raises is why? Right? Why would we have a body where the immune system is attacking itself? And that kind of launches you into understanding autoimmune diseases.
And before we go a little bit more into that, how does nutrition really play a role within autoimmune diseases?
Well, incredible. So first of all, you have to understand, let's go back to that, one step back to that question. So why would the body be attacking itself? Right? That's the question you have to start with. We have this, if we cut our knee, it'll swell, it'll get a little red, it'll be a little painful, and guess what? That knee will heal and we'll be able to recover. Right? If we drink a little too much on the weekend, we'll recover and our body will feel better. We'll be able to work through different stressors. If we eat a meal that's not great, then we can work through that and feel better. So the question is, why is the body not healing? And even worse, why is it attacking itself? That's what you have to understand. That's what we have to ask. So medically, the solution is immunosuppressant drugs. Basically, broadly speaking, the medications for autoimmune diseases suppress the body's own immune system which have the benefit of calming down the symptoms and the side effects of increased risk of infectious disease and cancer. That's broadly speaking what's going on. But your question was about nutrition. So what does that have to do with autoimmune diseases? Well, the question I would have, or the question I look at is, why is the body attacking itself? Why is the immune system actually attacking itself? And that, I think, is a question that's not often asked in medicine, but is somewhere between 100% super important that we ask. So what's the answer to that question? So the answer is, imagine you've got a cell in the body, and that cell is injured, gets hurt. And just like if you see roadkill on the side of the road, the animal gets hit and the vultures come and start eating it and picking it apart, and there's guts on the road and stuff like that. Well, imagine that's what happens to a cell. It's in the body, it gets injured, gets hurt, and it kind of spills out. What happens at that point is the proteins and the constituents of that cell that are supposed to be inside the cell protected are now out there in the bloodstream and exposed to the immune system. And at that point, the immune system is able to sensitize to those body proteins, which means the immune system can sense things in the blood that aren't supposed to be there. In this case, the cellular contents that got expelled when they were injured. And the immune system starts sensitizing to the body's proteins. So that's the sensitization mechanism. So the question is, what causes the body's cells to swell and spill out in the blood? And this can be anything from toxic elements, trauma, chronic infection, radiation, dehydration, infection, vaccination, nutritional deficiency, toxicity, inflammation. It kind of goes on and on. The example I would give is this. The cell, when it's healthy, is like a boat, right? It's when the boat's injured and starts falling apart and pieces of the boat end up in the water that the immune system says, hey, this isn't supposed to be here, and basically starts sensitizing to that. So what's the role of nutrition? Well, it makes our cells stronger, tougher, more resilient, so they can better withstand the stress and the strain of life, so they can better withstand trauma, better withstand infection, better withstand toxicity, so that they're less likely to spill out into the blood, less likely to lead to that sensitization of the immune system, and then consequently the immune system is less likely to be dialed in on that particular part of the cell and then finding it and attacking it like a seek and destroy missile in the body.
So that's interesting in the way nutrition can play a role, right? And so then obviously the next question is, what does that diet look like? What does an autoimmune diet really consist of?
Great. So great question. So there's two parts of that. So the first part is, how can we strengthen the cells in general? Right, and the answer to that is, I'll give you a list of things we can eat more of, right? Generally, pasture-raised chicken, sustainably sourced, wild-caught fish, grass-fed beef, from animals that can walk around, eat grass, beans, vegetables, salad, fruit. Things like that are all incredibly helpful for the body. So consequently, is what triggers autoimmune disease? Well, I'll give you two groups. The first group is foods that are generally toxic or poisonous no matter who we are, right? No matter what sort of disease you have, these are things like you want to avoid as a body. So number one, sugar, white refined sugar, top of the list, not surprising. Second is sweeteners, kind of in general. This gets into things like high fructose corn syrup and even some forms of like agave is relatively high in fructose, or high levels of fructose can be problematic. Vegetable oils, most of them just deserve to be thrown in the garbage, not healthy. Most grains, especially gluten-containing grains, most pasteurized dairy, or most dairy, especially pasteurized dairy and soy, except fermented soy, any non-fermented soy, are generally foods that are just not healthy for anyone. Then there's certain foods that can be healthy, but can also trigger autoimmunity. So these are things like eggs, right? Eggs can trigger autoimmunity. Nightshades. Nightshades are especially indicated, or can be a problem for people, especially with arthritis. So a common side effect of nightshade sensitivities. And just to define nightshades, these are things like tomatoes, eggplant, tomatillo, There's a whole list, a whole family of nightshade vegetables, but those are or nightshades, but those are generally ones that fall on that list. Legumes, nuts, and seeds can also fall on that list, and things that generally can trigger autoimmunity. And when I say trigger, we gave one mechanism at the beginning for triggering autoimmunity, which is a cell that gets damaged. It explodes like a water balloon, and then the contents of that cell end up in the bloodstream, and the body sensitizes. The body, specifically the immune system, sensitizes to it, and then you create this like heat-seeking missile to go through the body and find other proteins like that. There's another way autoimmunity can get triggered, and that's this idea. You can see it sometimes with infections. It's called molecular mimicry, but certain bacteria or parasites can look like certain organs of the body. Well, certain foods can trigger the same thing. So pasteurized dairy has been linked, to an increased incidence, not conclusively proven, but definitely linked, and I've seen it a lot in my practice, to destruction of the pancreas and ultimately type 1 diabetes. So things like gluten are very much connected. So autoimmune reactions to gluten can also trigger autoimmunity with the thyroid. So those are examples of some foods that can also trigger that, trigger the immune system, sensitize the immune system, and dispose us to autoimmune disease. So we're talking about staying away sugars, sweeteners, vegetable oils, grains, dairy, soy. That may seem like a lot to someone, and it probably is. But for anyone listening, if you just make one baby step in that area, you're definitely getting healthier. And if you want to take multiple steps, the more the better. Eggs, nightshades, legumes, nuts, and seeds are things that could be in that maybe area. Depending on autoimmune disease, again, over 159 different types. There's a lot of, biochemical individuality, which means you're different than I'm different than most of your listeners. So there's a lot of variation within that, but those are kind of the common ones that we'll find there.
Which actually leads me to the next question, which is what I was going to ask you, if this autoimmune diet is really a one-size-fits-all approach, which it seems like it needs to be personalized and customized a little bit. And if so, how does one go about doing that?
Yeah, good. So one is you can work with a practitioner or coach of some sign, whether it's a nutritionist or a health coach or some kind of lifestyle coordinator that can help you understand the signs or has a mechanism or way of testing it. So what you're looking for, here's the general rule, is like when you eat something, you should generally feel good after it. And if you feel worse, headache, elevated heart rate, bloating, gas, stomach issue, that's a sign that's like something's not right there. It doesn't mean you're allergic to that food. It means something's not right there. Could be an issue with the food. It could be a true allergy, which is actually an immune response to the food. It could be an intolerance. Could indicate a digestive difficulty in the stomach. Could indicate something like a leaky gut. So you really have got to dive into, to get to your question about the one size fits all or not, it's not really there. So number one thing I say is find a great person you can work with to help you with that. For the listeners who's saying, I want to kind of do this on my own, I'm like a Lone Ranger kind of person, I'd say that's great. But what I want you to do is really keep a detailed food log and track how you're doing after each meal. And this may seem simple, this may seem like not that helpful or just really basic, but I'll tell you the incredible knowledge you will get just from listening to your body and tracking it. And then when you have a bad day, putting on your Sherlock Holmes outfit, pulling out your magnifying glass and going back and looking, okay, every Wednesday I feel like this, or 2 of the last 3 days I felt this. What's the commonality in the diet? What's the commonalities in stress or sleep or workouts or whatever the pieces is, to dive down and look. Because, here's the thing, it's not, the worse our diet is to start with, the harder it is to find, because there's so many different factors getting there. The more we can kind of clean up our diet as like a level 1 solution, then what we'll find is we'll have more good days, which will make the bad days stand out more and make them easier to find. So that's a couple different ways. There are some lab testing to look at in terms of, you can look at different food arrays to look at food allergies and sensitivities. I find mixed results with those. I find they're useful, but they often don't tell me, I don't use a lot of them because they often don't tell me why the person's developing the allergic reaction. Are they truly allergic to it? Like, is somebody really allergic to an apple? Or is it just a functional response, meaning they don't have enough stomach acid, so the apple's not breaking down the pieces the apple should break down into, so they're developing an immune response? Or is it because they actually have a leaky gut or they don't have the right bacteria in the gut? So the apple is not fully broken down and leaving the gut, triggering that immune reaction. So just because it shows up on a blood test, that's an easy way to do it. I just find it's a little too simplistic to really give us that whole picture of exactly what's going on.
Mm-hmm. And I find that so interesting because so what you're saying is in order for us to be able to manage the autoimmune disease and be able to do that, it's really understanding that relationship with food and what is the core reason the food is irritating or causing any kind of sensitivity. There's a little bit more and you have to sort of peel back the layers to understand. And I hear what you're talking about with the food log and time and again, and even through the work that we do at Yemlish, it's so hard to convince someone to keep a food log as well. Can you, and maybe this can help in that direction, can you just really help explain the potential benefits then of following this autoimmune diet for individuals and what impact can it have on their lives?
Well, tremendously, and you can feel better. I mean, best benefit is you can feel better rather quickly. Right? For somebody with a thyroid issue, just by avoiding gluten 100%, you can see the autoimmune antibodies of the thyroid, something called thyroid peroxidase or a couple of others. You'll find them drop just from staying away from that. So what can someone notice? Generally, the things you notice when you feel healthier. So more consistent energy, more clarity of thought, better digestion, sleeping better. Because the great thing is, the more your diet is based on whole foods, has good quality healthy fats, good quality protein, lots of good vegetables, and I'd say fruit consumption and kind of starches, that would really depend on where someone's at. Some will do better on more of those. Some, especially those with blood sugar issues, you're going to want to minimize those or stay closer to the low sugar fruits or really keep a good count on that. There's some individual variations, but I'll tell you that I just ask your audience how many of them have eaten a meal and felt better, and how many other of them have eaten a meal and felt worse. They felt indigestion, they felt tired, they felt fatigued. What those are, quite simply, are signals from your body. And the question is, what are you going to do with that information? Are you going to listen to it, or are you going to take another Tums? Right? And if you want to listen to it, each time you listen to it, you strengthen that connection between yourself and your body, and you take step by step there. And it may be, some days it may be a big step, some days it may be a baby step. But the more you can consistently take those steps, then it'll get easier to listen to the more subtle messages from your body. And the more you get that communication going and dialed in between yourself and what you eat and how you feel, the more you can listen to them. Because here's the thing, you can look at ancestral diets throughout the world, and they are radically different. Like the ancestral diet up in Alaska is 90% animal fat, right? Very little fruits and vegetables up there. You got animals, you got fish, and you have very few vegetables and fruits growing up there, little nuts and seeds. Then you can look at the Maasai down in Africa, a lot of vegetables. You can have more blood and the occasional bit of meat, and you can look at coastal populations that eat a lot more fish, and you can eat some that actually are more agrarian. But what you can see is incredible variation across these different cultures. But what is 100% true is all of them have the nutrient requirements compared to the standard American diet about 4 to 7 times higher. So it doesn't matter if they're vegetarian, it doesn't matter if they're more carnivore or meat-based. You'll find they all have evolved to have the nutrients. And how do we know? Because life has survived there. Because if it didn't have the nutrients it needed to sustain life, people wouldn't have survived there for hundreds or thousands, or in many cases, longer than that. So we have this incredible ability. And how they figure that out? It wasn't by reading a nutrition blog back 2,000 years ago. Right? It was around listening to the body and understanding that communication. We all have this incredible innate wisdom within us. And it's that innate wisdom that when we hit our knee and we scratch it, it sends more blood flow to the area, and it makes it swollen, and it makes it red, and it sends more platelets there to clot the blood and go through that. That's that inner wisdom of the body doing everything it needs. And you make roughly 1 million red blood cells a day, and you also recycle or kill off roughly 1 million red blood cells today, and that happens 100% without you thinking about it. And that's just one example. So the more we can listen to our body, tap into that innate wisdom, it's less about the latest diet book you read, and it's more about understanding what makes you stronger, healthier, more energetic, and what foods cause you to feel the opposite. And so general rules on that, that's, like I said, staying away from sugar, sweeteners, vegetable oils, gluten, grain, dairy, soy, those, especially pasteurized dairy and fermented soy, those are generally just no-nos. A lot more healthy fats, quality protein, vegetables, kind of intelligent use of fruit. Buckwheat it's a gluten-free grain, can be really, really great in healing. Avocado, olive oil, coconut oil. And then we kind of have that middle ground of nuts, seeds, eggs, nightshades that kind of depend on the type of autoimmune disease we have and the symptoms that are going on.
Are there any downsides potentially to following this autoimmune diet?
So it depends what we have to define what that autoimmune diet is. But if we define it as I just did, which is increased meat, fish, pasture-raised, sustainably sourced fish, beans, peats, nuts, vegetables, salads, fruits, it's hard to have downsides doing it that way. Now, there's a lot of benefits to vegetables. The problem with most vegetarians is they're actually not vegetarians. They end up being sugaritarians or carbitarians, right? Or wheatitarians or pastatarians, right? So I say that to say we could take any of these pieces to an extreme and cause an issue, right? If you say, hey, we want to increase that stuff, and somebody said, I'm going to eat nothing but fruit, well, there's some things we could be lacking with that. Or the same thing with vegetables, because we need a balance of some of those nutrients. But if we take a broad strokes approach and we listen to our body and we're generally high in those foods and generally staying away from, the pasteurized dairy, the genetically modified wheat and soy and things like that, it's hard to find them there. Now, there can be the individual variation. It's the amount of vegetables you do well on versus myself, or the amount of meat and fish you might need versus I might need. That's going to vary person to person, so there's definitely some value in dialing in, but almost everyone will benefit from cutting out. I can't think of anyone who wouldn't benefit from cutting out the sugar, the sweetener, the hydrogenated vegetable oils, grains, gluten soaked with glyphosate or Roundup, and some of the fermented or non-fermented soy and the pasteurized dairy. I have not seen that go wrong. Now, that said, as somebody comes off that, there can be some symptoms, right? If somebody's used to burning sugar and carbs for energy, they probably need to eat every few hours. They're probably crashing in the middle of the day. So as you pull those away, especially if that's done quickly, there's some steps you might need to do to have them eat more often, increase the protein, increase the fat consumption, and knowing that that's going to roller coaster a little bit for a period of 3 to 4 days to a week or two. So there are some transition costs. But in terms of negatives to that, I'd be hard-pressed to find any.
And with that, Dr. Jeff, we are toward the end of the episode. At this point, I would love for our listeners to know how they can connect with you and then just learn more about your work.
Awesome. Well, fantastic. Well, I really enjoyed the interview, and thank you so much for the questions, because I think this is a very valuable thing to talk about. And we're talking about 50 million people just in the United States, 300 million people worldwide. So this idea of an autoimmune disease is unfortunately growing, or dare I say, exploding. So this is a very valuable thing for somebody to really understand, especially because the traditional medical idea is basically just, kind of ignore food, ignore diet, and just shut down the immune system, which again can be helpful, can be short-term benefits from that, but it definitely has some long-term concerns or side effects, and you can read those on the medications, or we've talked about some of them here. So anyway, I appreciate you bringing this up, and so give us a chance to educate patients on and listeners on what they can do to kind of be empowered around that. So if they want to connect with me and kind of learn more, follow along, best way to find me is probably on Instagram. You can find me at Jeff Crippen, JeffCrippen, on Instagram. Or if you want to learn more about what I've worked on, published a book earlier this year called Timeless Youth, The 5 Truths of Transformational Wellness and Holistic Healing, where we go into a lot of those pieces that actually help us rewire the mind on actually what is health. Because the biggest issue, I think, in the disease care system is that it's often confused for healthcare. But the thing is, if you want to create health, you need to actually understand what health is. Right? It's like you can't get to California unless you know where California is. You can't create health unless you understand what it is, and there's certain principles that help health, and that's why I wrote the book. I wrote it for my parents when I was 6 years old, who were trying to figure out where the heck you take your son when they have headaches, and they're searching for answers and just going to doctor after doctor, try to find that. I wrote it honestly, for the woman who's got an autoimmune disease and got problems, and they've been to the doctor, and the doctor looks at their blood work and said they're fine, and they look back at the doctor and says, you're not listening to me, I don't feel fine at all, like, well, we'll see you in 6 months, or we'll give you an antidepressant, right? Which is all too often to happen. So that's why I wrote the book, to kind of help patients understand what is health, what are the principles there, and how can you apply it and kind of supercharge that. So anyway, you can find me on Instagram. You can find the book, again, Timeless Youth, from there. And super passionate about what I do. Appreciate the opportunity to come and share this message, and love to continue to be a resource to any patients and any clients, and they can reach out on Instagram with any questions. I'm happy to answer and respond to those. I get back to those as soon as I can.
Lovely. And with that, so what we're going to do is we're actually going to link up this book in the show notes as well. So if you're interested in learning more about the book, you can certainly click on the link in the show notes below. With that, Dr. Jeff, thank you so much again for your time. To our listeners, thank you for tuning into another episode. For our listeners who follow a particular autoimmune diet, or if there are certain things that you were doing as you are sort of navigating yourself or autoimmune disease for a loved one, head over to our social media, our Facebook, our Instagram. Find this podcast post and comment below to share with us some of your favorite meals and to tell us why you love it so much. So head over to our Facebook, our Instagram, and again, head over there and tell us exactly how you sort of carved a path for yourself in terms of foods that you're eating, meals that you're preparing for yourself, for your family members, as you try to navigate either for yourself or for a loved one an autoimmune disease. We'll continue the conversation there. Thank you again, Dr. Crippen. Really appreciate your time.
Thank you, Shireen, and thank you for your patience.
Thank you for tuning into this week's episode. Exclusively for our podcast listeners here today, Dr. Crippen is offering a signed copy of his new book, Timeless Youth. Head over to our Instagram and our Facebook and comment on the podcast post to be entered. We'll see you there.